Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have corneal opacity, which is leucoma. Leucoma is actually a dense corneal opacity, and this leucoma occurs due to the scarring, and here the scarring is involved. More than two-thirds of the stroma is involved in the scarring here, and it is treated same as the macular opacity. That is, we can treat it either by the optical iridotomy or we can treat it by keratoplasty. So for leucoma, we can treat it by either optical iridotomy or by keratoplasty. So in leucoma, it is a bigger lesion which involves the more than two-thirds of the scarring of stroma is involved in leucoma. So treated by optical iridectomy and also keratoplasty.
thank you and thank you for watching.